Heart disease is the leading cause of death in the United States. The month of February is dedicated to raising awareness about heart disease and increasing knowledge about prevention. Tomah Health Cardiac Rehabilitation Coordinator Shana Steele explains how to keep your heart healthy and prevent heart disease during this edition of Healthcheck 360. So welcome, Shana.
Thank you
so much for being here. So what is your role at Tomah Health, and how do those services that you supply, help offer those patients to help get a healthy heart?
Yeah. So I'm the Cardiac and Pulmonary Rehab Coordinator at Tomah Health, and I've been there for over 16 years.
Oh.
And so cardiac rehab is a medically supervised exercise program to improve cardiovascular health after somebody's had a heart attack, heart failure, angioplasty, heart surgery. And it includes exercise training and lifestyle education.
So what kind of exercises do you do? Is it just like breathing exercises, or is it actual working
exercise?
out? Okay.
Yep. Treadmills, ellipticals, steppers, you name it.
Just to get that heart pumping.
Exactly. Get that blood flowing.
Definitely. So what is heart disease then? And what are a few things people can do to prevent it on their own?
Yeah, so heart disease encompasses a wide variety of heart conditions that affect how well your heart functions. The four common forms of heart disease are coronary artery disease, so you have damage or disease in the major blood vessels of the heart. Heart failure, which is a chronic condition where your heart is not able to pump efficiently. Heart valve disease, so damage or disease in the heart valves. And arrhythmias, so improper heart rhythm, whether too fast or too slow. And 5 different ways to help maintain that healthy heart, especially during Heart Month.
Definitely.
One is don't smoke or use tobacco products. Of course, we all know that. But exercise regularly. So that's what we promote. So the American College of Sports Medicine promotes at least 30 minutes of moderately intense aerobic exercise at least 5 days a week.
Okay.
And also strength training at least 2 days a week. We always recommend eat plenty of fruits and vegetables, foods high in soluble fiber, get good quality sleep, at least 6 to 8 hours a night.
Easier said than done.
Right. And always visit your healthcare provider regularly.
Definitely. So heart disease can definitely affect anyone, and sometimes you don't know that you have a disease or something happening, but it seems that women are usually at the top of that list. Why is that?
Yeah, so while heart disease may be the number one cause of death for both men and women, it tends to develop later in women because the effects of the hormone estrogen is a cardioprotective benefit. But of course, after menopause, usually by age 65, heart disease odds match those of a man of similar age.
Oh, that's very interesting.
Yeah.
I guess once you say that, it makes sense, but when you actually think about it, like at first you're like, huh? Really? Why? Like, for men and women should be the same. We both have a heart. Like, why?
Right. Yeah.
So is there any special news or good news coming from the Tomah area?
Yes. So Tomah Health strives for best practices, and we are excited to be a partner hospital in the AHRQ's Take Heart initiative, whose goal is to help hospitals implement evidence-based strategies to increase cardiac rehab participation in eligible patients by implementing automatic referral with care coordination support.
Oh, wow.
Yeah, so we're excited about that because only 1 in 5 patients are actually referred to cardiac rehab.
Oh.
So we want to improve those numbers, reach more patients to provide them with exercise training and lifestyle education to help reduce risk factors for heart disease.
Absolutely. Is there a place that viewers can go to, like, is it your website, a Facebook page, or somewhere that they can learn more in case maybe they know somebody that needs that extra help or something?
Yeah, so tomahhealth.org is a great resource.
Okay.
We have our own page on there for cardiac and pulmonary rehab, so you can see all of our staff and what we do to help the community improve their heart health.
And then lastly, quick, do you guys post, since you're celebrating this month, are you guys posting online little things to help educate the public and stay updated with you guys?
Yeah, so we Wear Red Day. We all supported that effort, and we do special things within our cardiac rehab department with the patients to get them excited to continue to reduce their risk factors and exercise and.
That's awesome. So definitely a good way to stay involved and a good way for our viewers to keep updated with helpful tips and see what you guys are doing to firsthand fight that. So thank you so much for being here.
Thank you.